Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Ratna. My friends and I are from Group 6. We would like to talk to you about vaccine. It has been more than a year and a half that the COVID-19 has been continuing to spread around Indonesia. Based on data on the covid19.go.id website, there are already more than 4 million Indonesians who have suffered and are currently suffering from this virus. Even more than 138,000 of them died. Therefore, this country has been continuing to strive to protect society from the threat of this pandemic. One of the country's efforts is an ongoing national vaccination program. Based on data on the covid19.go.id website, more than 71 million people have been vaccinated at least one dose. Meanwhile, this is still far from the national vaccination target of around 208 million people. Why are so many people still unvaccinated? Are you among those who have not been vaccinated? According to Margo Yuwono, as the head of the Central Statistics Agency, the survey results they have conducted show that 15.8% of people do not want to get vaccinated because they are worried about side effects. Then 4.2% of people do not want to be vaccinated because they do not believe in the effectiveness of the vaccine. In fact, vaccination is not a new thing. Maybe we are not familiar with the term vaccination, but haven't we been familiar with immunization since childhood? Based on the Centers for Disease Control and Prevention website, immunization is a process by which a person becomes protected against a disease through vaccination. Surely, some of us still remember the memories of being injected in elementary school. Let's try to remember whether we used to cry when we were injected or not. Or did we see our friends cry? So, according to the Ministry of Health, there are 5 complete basic immunizations given before a baby turns 1 year old. The provision of complete basic immunization is useful for comprehensive protection against dangerous diseases. Then there is School Child Immunization Month. The Health Office carries out further immunizations for elementary school-age children. The immunization program is carried out to provide protection for them against measles, diphtheria, and tetanus. So we can realize that we have been vaccinated or immunized several times since childhood.
Hello, I'm Rosa Amelia and I will continue the discussion from my friend before me with the topic vaccination and immune system. The increase in positive cases of COVID-19 in several regions has jumped quite sharply. The high number of positive patients for the coronavirus has caused many hospitals to run out of treatment rooms. Not only in Indonesia, several countries have also shown an increase in the positive number of COVID-19. However, this cannot be an excuse because Indonesia's conditions are different from other countries. Some time ago, the World Health Organization or WHO announced that the spread of the coronavirus can occur through the air. In its latest guidelines released on its official website, WHO finally include air as one of the transmission or modes of transmission of the coronavirus. Coronavirus transmission can occur through droplets when someone coughs, sneezes, sings, talk, and breathes. In addition to the mode of transmission of the coronavirus, WHO also mentioned several places that are prone to being placed for the spread of the coronavirus, such as crowded places, cramped places, limited and closed rooms. The immune system has a major role in protecting the body from bacteria, viruses, parasites, or fungi that causes disease. If the body immune system is weak, the body will not be able to fight virus, disease causing microorganisms, including the coronavirus. Giving this vaccine is the most appropriate solution to reduce and break the chain of the transmission of COVID-19. Vaccination aims to provide specific immunity against a certain disease so that if one day exposed to the disease, it will not only experience mild symptoms. In addition, the COVID-19 vaccination can also maintain productivity and reduce social and economic impact. Like vaccines in general, the COVID-19 vaccine has the potential to cause side effects for the recipient. Side effects such as arm aches, fever, nausea, and so on are very common after receiving the vaccine. This is a sign that the vaccine is working and the body is building antibody to fight viruses that may impact in the future.
Hello, my name is Rifa Aprillia and my student number in here. So, I want to tell you about how vaccine work and what the function of vaccine. So, vaccine work by training the immune system to recognize and fight pathogen, both viruses and bacteria. To do so, certain molecule of the pathogen must be introduced into the body to trigger an immune response. This molecule called antigen are present in all viruses and bacteria. By injecting an antigen into the body, the immune system will learn to recognize it. As a protector of the body, the immune system will attack, produce antibody, and remember if one day the bacteria or virus reappears, if it later appears, the immune system will automatically recognize the antigen and attack aggressively before the pathogen spread causing disease. So, I want to ask you, do you know what vaccines are available in Indonesia? If you don't know, I want to tell you. Vaccines available in Indonesia include Sinovac, AstraZeneca, Sinopharm, Moderna, Pfizer, and Novavax. Of different kinds of vaccines are available, the function of each vaccine is the same. First, prevent exposure or experience symptoms COVID-19. In the frequently asked question, the comment regarding in the implementation of the COVID-19 vaccination, which was uploaded on the official website of the Directorate General of Public Health of the Indonesia Ministry of Health, it was explained that the COVID-19 vaccination did not make us 100% immune from COVID-19. However, the COVID-19 vaccination will reduce the impact if we contract COVID-19. Vaccination is a process in the body where a person becomes immune or protected from a disease, so that if one day they are exposed to the disease, they will not get sick or only experience mild illness. As with the benefit of other vaccines, the COVID-19 vaccine is useful for protecting the body from falling ill due to COVID-19 by generating or stimulating specific immunity in the body. Therefore, even though we have been vaccinated against COVID-19, it is recommended that we continue to carry out health protocols, wearing masks, washing hands with soap, and maintaining distance to prevent transmission of the coronavirus. Second, protect others. The COVID-19 vaccination can prevent us from spreading the coronavirus to others. If vaccination coverage is high and evenly distributed in an area, then herd immunity will be formed. Herd immunity is a situation where a large part of the community is protected or immune to a certain disease, causing an indirect effect, namely protecting vulnerable group of people and not being the target of vaccination. This condition can only be achieved with high and equitable vaccination coverage. Most experts believe it takes at least 70% of the population to be vaccinated to achieve herd immunity. Third, stop the spread of the COVID-19. Basically, vaccination is not only aimed at breaking the chain of disease transmission and stopping the outbreak, but also in the long term eliminating or even destroying the disease itself. 4. Help protect the next generation. According to Mayo Clinic, one of the benefits of the COVID-19 vaccine is that it prevents the coronavirus from spreading and replicating, which allow it to mutate and possibly become more resistant to vaccine. By reducing the rate of COVID-19 infection and breaking the chain of the COVID-19 pandemic, we can also protect the next generation from the long suffering of being infected with this disease. This is evident from historical records that have occurred. There used to be many diseases caused by viruses that could be deadly. With vaccines, disease can be controlled. So, protect yourself and protect the country. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Chikal and I'm here to continue discussion about the vaccine and about COVID-19. And then after that, we will talk about the effect of the vaccine to the people. The people get some vaccine, and many countries has got vaccine campaign in their countries. After vaccinating, the community will get a stronger immune system, and the virus that is spreading widely can already be tamed and defeated by the vaccine that is injected into the body. Because there is a lot of data that says from various countries that after many people in the country have vaccinated, then the level of people exposed and infected with the COVID-19 virus has decreased significantly, as shown in the following table. That the vaccine has effect of the COVID-19 symptom and effectively reduce the spreading of the virus, and make sure that people that had been vaccinated will get stronger immune, and the end virus will has not a place for spreading, and our life will come back to normal again. And this is the table. Okay, enjoy. You can see as you can see in the table and from the statistic, there is reduction from the infected of COVID-19 and increase of the healed people in Indonesia, also in the many other countries and the whole world. And you can see there's some data and table about the infected of the virus. And the last is equitable access to safe and effectiveness vaccine is critical to the ending to the COVID-19 pandemic. So it is hugely encouraging to see so many vaccines proving and going into development. WHO is working tirelessly with partners to develop, manufacture, and develop and deploy safe and effectiveness vaccines. Safe and effective vaccines are a game-changing tool, but for the foreseeable future, we must continue wearing masks, cleaning our hands, ensuring good ventilation indoors, physically distancing, and avoiding crowds. Being vaccinated does not mean that we can throw caution to the wind and put ourselves in at risk, particularly because research is still ongoing into how much vaccines protect not only against disease but also against infection and transmission. Is the impact of COVID-19 vaccines on the pandemic will depend on several factors. These include the effectiveness of the vaccines, how quickly they are approved, manufactured, and deliver, the possible development of the variants, and how many people get vaccinated. While trials have shown several COVID-19 vaccines to have high level of efficacy, like all the other vaccines, COVID-19 vaccines will not be 100% effective. WHO working to help ensure the approved vaccines are as effective as possible so they can have the greatest impact on the pandemic. Okay, that's all from me, and maybe my friend will continue this discussion. Thank you.
some countries that have been free from corona because of vaccination. The first is South Korea. South Korea is the most recent country to free the use of masks. Last week, they confirmed that masks will no longer be required outdoors from July for those who had already been vaccinated against at least one dose of the COVID-19 vaccine. The move is an attempt to encourage the older residents to get vaccinated. South Korea aims to vaccinate 70% of its 52 million population by September. The second is the United States of America. The United States government allows citizens to move without wearing a mask. However, with the condition that they must have been vaccinated against COVID-19 in full or twice. The U.S. itself used the Pfizer or BioNTech Moderna and Johnson vaccines. The vaccine has used 90% efficiency. The third is Israel. Israel has also waived the mandatory use mask since April. More than 50% of residents have also been fully vaccinated. Like the US, Israel used the Pfizer or BioNTech vaccine. However, a number of restrictions are still in place to prevent a new variant of corona from entering the country. Israel is a real example of a country that can control COVID outbreak thanks to its high vaccination rate, because from the discovery of COVID-19 vaccine, the daily number of cases in Israel could have reached 8,000 at its peak. Along with the vigorous vaccination movement, Israel began to move back to normalcy last May. The presence of the Delta variant triggered a new wave in Israel, averaging around 75 cases per day. So, true, the new variant could fight the vaccine in some cases. However, let's look at the big picture. Before vaccination, 8,000 cases per day. After vaccination, less than 100 cases. This means that although vaccination does not 100% protect immunity against COVID, it prevents severe symptoms and is very effective in reducing the risk of death. So, from the data I have provided, vaccination carried out by a number of countries for their people can reduce the number of COVID cases. Maybe this is also the time for us to vaccinate so that we can quickly to get out from this pandemic and live back to normal without masker like the countries I've mentioned earlier. Thank you.